The head of the Therapeutic Goods Administration says a range of issues are still under investigation after the death of a woman following her receiving the AstraZeneca vaccine. The group last night likely linked the 48-year-old's blood clotting and low platelet count to the jab. Let's bring in our reporter now, Rani Heyman. Rani, what more do we now know about this case involving Janine Norris?
Well, authorities confirmed on Thursday that a 48-year-old woman had passed away, and her name was Janine Norris, and she's from the Central Coast of New South Wales. Now, the Therapeutic Goods Administration met late yesterday afternoon to determine whether there was any link between her death and her having the AstraZeneca vaccination. Now, they have linked it, saying that it is likely that her death is likely linked to the AstraZeneca vaccination. They have said that she did have underlying medical health issues, so they haven't disclosed what those issues are, but they have said that they won't do that because of privacy reasons. Now, this is the third case of extremely rare blood clotting that has been linked to the AstraZeneca vaccine in Australia, and that's from roughly 885,000 vaccinations that have been administered. So we do know that she was vaccinated on the 8th of April prior to the decision of the federal government saying that people under the age of 50 were no longer required or were no longer being told to have the AstraZeneca vaccine, but rather being advised to have the Pfizer vaccination instead. So here's a bit of what the Health Minister, Greg Hunt, had to say today.
The government will ask ATAGI to ensure continuous review of all of the vaccines in terms of their safety and their efficacy. That work is already conducted by the Therapeutic Goods Administration, but continuous review is exactly why we have prioritised safety above all else.
Greg Hunt there. So, Rani, do we know when we can expect a definitive answer around the death of Janine Norris?
So we're expecting a definitive answer soon. However, we do know that the New South Wales coroner will be investigating her death. We do know that there will be an inquest into her death. Now, the TGA is still waiting on some laboratory results from Ms Norris, and an autopsy will be conducted on Monday. So we should have further information from there. But Greg Hunt has said that there are still a range of issues that are under investigation, and the Therapeutic Goods Administration Deputy Secretary, Professor John Skerritt, also spoke this morning, and here's a bit of what he had to say.
There is comprehensive information available from health professionals and also for patients on how to identify these very rare signals of what is a very rare syndrome, and also for doctors advising what to do if they suspect their patient may have such a case.
Now, we have also heard from authorities in the last couple of weeks that the health advice will be under constant review as this vaccination rollout continues. So we don't know exactly whether there will be updated advice given at some point in time, but we do know that that is forever changing.
And Rani, there's some fresh news as well out of New South Wales. Just bring us up to date there.
That's right. So we've just heard this quite recently. So New South Wales Health is investigating a possible COVID transmission within hotel quarantine in Sydney. New South Wales Health has said that 7 returned travellers from overseas have tested positive in hotel quarantine. They have been identified as having the same viral sequence, suggesting possible transmission of coronavirus within that particular hotel. They're from 2 separate family groups. They've come in from 2 different countries, and they are staying on the same floor at the Adina Apartments Hotel in the Sydney CBD. Now, the health department has said that it will be investigating this further to determine exactly whether there was any viral transmission of this virus within the hotel, but that is yet to be heard.
No doubt a case that we'll be picking up on throughout the day. Rani Heyman there with all the latest. Thank you so much.